Okay. Maybe.
Yes, sir.
I don't know. Still see it?
Yes.
Yep.
Right.
Yes.
Susan, Mike, y'all let me know if you think we got enough folks online to get going. My screen is not working where I can see everybody and see the presentation. So I'll let y'all be my eyes and ears.
I'm going to screenshot the attendance list to try and keep an eyeball on it, but I think we're recording anyways.
We are.
Yes, I did start the recording.
Awesome. Okay.
It looks like we have a pretty good group here.
I love it. Okay. Well, good deal. Well, we'll get started. Welcome, everybody. My name is Glenn Ferris. I am one of our national accounts directors, and I'm in charge of all of our solution delivery for, which will be complicated as we get through. I'm going to say it this way: Advocate Healthcare, Atrium, and also our point here is around Harbin Clinic and the project. So you're going to hear a lot of different names when it comes to who our client is within this project. But I'm very thankful for everybody on the call. Thank you for the trust you put into us, for the relationships with our recruiting team, onboarding, all the team that you've met, and really thankful and appreciative to have you on our team here. I've been here at our firm, Etain, now Experis Health, for 21 years. And again, thankful for the opportunity to work with y'all to ultimately, and this is why we do what we do, is make sure that the patients and the providers there within the Cartersville, Rome, Georgia area are taken great care of. That's really the heart behind what we do. I'm actually from Ackworth, Kennesaw area myself, so I know this area really well. Played a lot of baseball in Rome, Georgia, and Cartersville over the years. And so again, that's my role. I'm going to turn it over to Mike. We'll go Susan first, ladies first. Let you guys introduce yourselves, and then we'll hop into it.
Hi, everybody. Thanks for joining the call. I'm Susan Norris. I'm the resource manager on Experis, and I will be working with this team to help support you throughout your engagement. I'll be sending out an email called Second Steps email that has information about timekeeping, payroll, benefits, all of those sorts of things. You should see that later today, and you'll want to hang on to that. And if you have any questions about that email, anything in it, anything at all, don't hesitate to reach out to me. So I'll get you in the right direction if it's not something I can take care of myself. But we'll be here I'll work with Mike Wilhoit and Glenn and be here to help support you throughout the engagement. So I'll pass it over to Mike Wilhoit.
Hey, everybody. My name's Mike. I'm acting as a kind of engagement manager / project manager for this project. So I think, Susan and I typically work very closely together on these things, but I think you can think of me as kind of like the liaison between Advocate and our company, Experis, and I'm basically your advocate too, helping, here to support you with whatever you need. So you ever have questions in line with what Susan just mentioned about time cards, stuff like that, you can feel free to reach out to either of us. We'll get that taken care of. But I'll also be I don't want to say managing schedule. I don't think the schedule will change a whole lot, but I will be working with you if we do need to, if someone needs to call out or whatever, sick, and get schedules replaced that way. But I think we'll get into that a little bit more detail later. But nice to meet everybody.
Awesome. Yeah, and I'm sure there will be questions. And hear it from me. We still have some questions, right? So as we do these projects around the country, we currently work with 650 healthcare systems around the country doing projects similar to this, as well as very different from this. I've personally worked with the Floyd team. Jeff Buddha is the CIO. He's a personal friend of mine. I've worked with him for about 15 years. And so I'll ask that you hold your questions till the end. Some of them, again, some of the questions might be applicable to Susan, some with Mike, and some are just processes. So we'll get through this. So we'll jump in. So client orientation and training, we just found this out. And again, please calm your fears. If you see this and you say, I can't make that, okay, that's okay. We literally just got this information from the client, and that's how some of these things work, okay? So we're going to have a virtual orientation with the client, who you'll meet name and things like that on this sheet shortly, this Friday, and that will be at 10 a.m. Eastern time. Very similar, right? It'll be a Teams or some type of virtual meeting. We'll record that as best we can, and if you can be there, great. If you can't, certainly understand. We want to make sure that we start appropriately, but we know that's this week, and that's a challenge. So, so that's the most current update. The great thing is that's virtual, so you don't have to plan for traffic delays to be on site this Friday. So don't worry about that. We do put this early and often as far as traffic delays go, and it's critical to be on time and dress appropriately. As we work through this project, you're going to hear me multiple times saying that, we are there to serve the providers, the nurses and staff across Harbin Clinic. Harbin is a physician group. Many of y'all know this and can say it more eloquently than I can. It's a physician group that works at Floyd Regional Medical Center, as well as other facilities around the Rome and Cartersville area. And so again, from a dress perspective, this is not my policy, their policy. No jeans, please. No open toe shoes. They are fragrance-free area, if that makes sense. And then we just want to be presentable, if that's fair, right? We're serving as guests in their environment that they're inviting us into. So that's important. I'm going to go through all of these locations. You should know at this point where and when you're going to be working, but there's 3 main locations that we're going to be supporting. So Cartersville, and you'll see that's the top location here is what it looks like. That's a facility we're going to be supporting starting on June 2nd, so next Monday. And again, you should know if you're there, and if you're not supposed to be there, don't worry about it. The Forum Event Center, which is listed below, many of you know what that looks like and have been to other events there. That's in Rome, Georgia. Beautiful facility there. And then the last one, which we're only supporting on Saturdays between 8 a.m. and noon, that's actually at Floyd Medical Center in their training facility. That shift is not starting until later. I say all of this because you've talked to recruiters, and we've probably said from the start, hey, we're looking for folks that can be flexible. And I appreciate all of you guys doing that. At the chance, right, that we might have somebody that calls out, we may ask you, are you willing to go X or to Y? And so I just want to call all these out. Not mandatory that you do that, but I want to make sure everybody knows where these are. Unlike many of our projects, there's plenty of parking at these locations. That's very rare in healthcare today. And so that's just something to know. We'll get very specific on where to park at some of these locations. As you can imagine, again, we're there as guests. We don't want to take up patient parking, if that makes sense, if we're going to be there for 12 hours. So we just want to be sensitive to that, no matter where they, allow us to park. Badges, we'll have those likely for you on your first day at your assignment. If not, some of these are, again, very public places, the forum per se, you're going to be able to get into where you need to be. Client contacts, just names, just to know, Lisa Hammond and Lisa Kraft. They are great folks to work with. I've worked with them for 15, 20 years. They're both located in Charlotte at Atrium's headquarters. They are responsible for all of training. So anybody that gets trained on any software, whether it's Epic, the EMR, or other things, across the whole Atrium health system. So those are 2 folks that are put all this training together. They're responsible and mandated to make sure that all of the doctors, nurses, and staff get trained. Tara Paget, some of you may know her, local to the area. She works there at Floyd. She's been a great partner to us, even as our team helped them at Floyd implement Epic about 3 years ago. And so you'll probably see her on site roundabout. Rich Alberon, good personal friend of mine, known him for 20 years. He is in charge of all of the Epic EHR and EMR implementations across all of Atrium. So Floyd being one of Atrium Advocates hospitals, he's in charge of all of those implementations, which includes the critical role you're playing is helping facilitate that training with our team.
Hey,
Let's
Glenn,
see. Yep,
I thought of another thing since you brought up parking.
please.
Yeah, well, for everyone, we recently found out at another Advocate location that some campuses require parking passes. So we may want to ask into that. You may know the answer to that already, Glenn. I just didn't know it for the Rome area.
That's a great call out, and some facilities do, Mike and team. And so again, those are some of the questions that, as I mentioned, even we are still finding out some of these nuances. And so
Anyways,
we hope to know that, by Friday.
I just wanted to make sure we were thinking of that, and I'll help with that on Friday. Thanks.
And again, some of y'all might say, well, they don't know some of these things and we're a week away. Again, they've been working on this project to implement Epic for over a year. Okay, so there's lots of things that are going into this. And so we're getting down to that crunch time, and some of these nuances we'll find out. And as you can imagine, if you know where the Forum Center is, well, there's public parking, there's paid public parking. I mean, there's some of those things that will work out for you. All right, day-to-day goals. I'm talking too much as normal, but really what we're there to do, we're there to help facilitate. So nobody on this call has to be an expert in Epic, or if you don't know what Epic is at this point, that's okay, right? We are there to absolutely make sure that we are being great customer service representatives, that we're being an extension of the Harbin team, the Atrium Advocate team, and really making sure that each person that walks through the doors, and we'll go through some of this stuff today and then into Friday, that we're addressing them, and making sure they feel welcome. So that means if somebody comes up, we're not just sitting down and leaning back in our chairs, taking our time. We're being proactive to say, hey, how can I help you? Hey, help me understand your role. So we're there to address questions, in real time. Again, you don't have to know all the answers. Minor technical issues, you're going to have kind of a sheet that shows you how to deal with some of those. But again, it's more of that being supportive and de-escalating situations, taking down challenges, and making sure we're facilitating. This second part, pre-go live training, again, what we're there to do, and you'll see this as we move forward, there's going to be classrooms that have between 20 to 100 PCs in them. And so those are going to be the PCs where these folks are going to be taking their online training. And so we're not there to help them click through training. We're not there to help them understand, how to do their training. We're there to help make sure that they are on the right training module, that they have the right equipment, hardware that they need, right? So headphones, microphone if needed, some of those things, and those things will be provided for you. And you're going to have a list on who gets what. So again, I know there's lots of questions with that, but really our goal, and I put it there, is that's that white glove treatment. We want, as people leave, to say, hey, training might have been hard or something didn't work, but my goodness, Mike Wilhoit, that guy, wow, he was at least patient with me, something like that. All right, so getting into some of the scheduling, again, you should know where you're going, times that you're going there. If you don't, again, that's a question that we can answer, at the end or through an email. But Mike Wilhoit is going to be, your person for all scheduling questions right now in Rome and Cartersville. Again, some things may change as far as who we may need to copy or communicate with the client side. So whether it's Lisa or Tara or something like that. But it's just really imperative that we understand that, some of these shifts, and all of them, we are the last line of support or the first line of support. So it's not, hey, we're sending, Corey there, and if Corey doesn't show up, there's 3 other people like Corey or like Susan. So I just want to make sure that y'all understand that. That doesn't mean you have to know everything. Hear me out. But it's imperative that if we say we're going to show up somewhere, that we do that. If you can't for any reason, it's absolutely critical that you send a text, right? You send something, a smoke flare. It's unacceptable in today's day and age that somebody just doesn't show up, right? The no call, no show, that doesn't have a place in this. Again, we're working with physicians and nurses and staff that are going to have to care for patients. If we're not there to help facilitate this training, they can't do that. And so it's critical we do that. There may be a Teams chat. So again, 20 to 100 computers, you're going to have a workstation, if you will, that you can use. More than likely, because we've done this 4 times before, just so you know, I've placed over 86 consultants in this exact same role that you're going to be filling, both in Rome and in Charlotte. There's more than likely a Teams chat. And so as issues come up or arise or things like that, you're going to have access to that Teams chat. And you're reading it. I'm just going to say it. It's imperative that we're professional in that communication. If you have a physician or a nurse or somebody that has a challenge or might not be professional, again, that doesn't give us credence to be unprofessional in how we communicate with that. So just want to make sure that I'm saying that out loud. Timekeeping, payroll, some of those things. Susan is going to be your person for that. And Susan, anything else you'd like to speak to that at this time?
No, I don't think so.
Okay, gotcha. More information to come, but
Glenn, I would just mention we set up we intentionally set up the schedules for folks just so it's very consistent for you and not a lot of shift changes. So like, for example, you're working the same 3 days every week. We just wanted it that way for simplicity's sake. So I hope you appreciate that, because then some of these engagements that we've been on, the schedule's really all over the place, or it can be, right? So we want to try and keep this as consistent as possible for you. And it's a short project, right? So I would think it wouldn't be all that difficult to do that. So just wanted to add that in there.
Absolutely.
I lied. I do have something to add.
Good.
So the time you'll get paid for this call as well as the client orientation on Friday.
Right.
Your timesheets likely aren't going to be set up by they should be by the end of the week, but we will enter the time today for you for sure. And then if your timesheets are available to you by Friday, you can, or at least by Sunday at midnight is like the deadline. So we'll keep an eye on that though, and communicate out to you if that's going to be any issues, and if so, we'll add the time for you.
Yeah.
I think that's it.
Awesome. And I'll jump around. It's my pet peeve to read every single line on a PowerPoint. So I wrote myself a note to say don't. So y'all keep me honest if I do. I've already gone through some of these things, so I'm not going to go through them again. But I think the great thing is with a client like Advocate Health, which Advocate and Atrium, right, have purchased Floyd, but we still have the same name. The great thing is they have multiple projects coming up. And so, for example, an amazing lady that I worked with on this exact project 2 years ago is now a full-time Epic analyst working for Advocate right now. Okay, so the great thing about these type of projects is that if you haven't worked on Epic, if you haven't worked in healthcare, or even if you have, the way that we handle this project and how well you do on this project really sets you up for an opportunity down the road to work with the organization. Or I have 3 folks that are consultants of mine now working around the country as Epic at the Elbow individuals that came out of this project 3 years ago. So I say all that to say that doing a great job in this project is a great stepping stone within the healthcare IT space. I will ask, as I say that, please do not ask for jobs or discuss how somebody that you help can help you get a job. I'll let that sink in for a minute. Many of you probably are thinking, why would he even say that? Let that marinate. You understand what's already happened, right? So I've had people in the past say, hey, I'm looking for a job. Can you help? While they're on this project. Please don't do that. We're going to help you with that. Please talk to your recruiter, right? Things like that, but we don't want to do that in this project. I'll talk about de-escalating issues. Your recruiter, many others, even on the interview questions, it talks about how do you handle somebody that might not be in a great headspace. This training can be frustrating. what they're doing is going online to do online training. All of us have done it. I don't know one person that likes it, especially when they might have a whole patient list that they need to get to, right? Or no matter what's happened at home. So there's going to be challenges. You might have challenges internally or something like that. Come to us first, if something arises. Think about how to say that with the right escalation points, and let's de-escalate correctly. Please make sure your cell phone's on silent. One of the biggest complaints that I've gotten over the years is, Sally Sue's in the corner, texting or playing a game, on his or her phone while there's doctors and nurses walking in. I get it, right? We all have personal things. We have to take it. Don't get me wrong. You have to do those type of things, but we want to leave a note. Hey, I'll be right back in 2 minutes, right? Something like that. Let's just be sensitive to what we're doing. Great. This is the team that we're working with right here. I should have said this to start. I'm going to send this out at the end. Could be one of your questions. How am I going to remember all this? We'll send this out at the end. All right. So I'm going to go through this very briefly. And again, I'm going to send this out. So Epic is an EMR or EHR, electronic health record, electronic medical record. Epic is one of the EMRs out there. There's others. There's Cerner, there's Meditech, there's other ones that you might have heard about. Epic is the industry leader. It is the enterprise EMR for all of Advocate, Atrium, and they are now implementing Epic as this medical record system within Harbin Clinic. They did Floyd a few years ago. If you've ever used MyChart, you're using Epic. And so classroom IT support is what we're doing right now because all of this training is done remotely for Advocate. So I mentioned, what is Epic? It is an EMR and it has many different modules, and those modules are broken down into what roles that you play within the hospital. So we'll go through this briefly. I am not an Epic analyst, so hear me out. I'm going to go through briefly through all these things. I am not the expert. They pay me to know experts. I'll put it that way. That's what I laugh about. So again, these are some of the things that Epic does, if that makes sense. Again, if you've used MyChart, you've used Epic. If you've ever been to Floyd or any of the other Atrium hospitals, your information is now in Epic, and it allows doctors and nurses to share information to help with patients across the world now. I'm going to go briefly through this. So again, these classes that your physicians, nurses, and staff are taking, they're broken down by what they do. So again, you can read through some of these examples. I'll use my wife, for example. My wife is a nurse anesthetist, okay? And so she's in an operating room. She uses a specific module of Epic, right, around surgeries and things of that nature. There's different modules. I'm not going to go through those, but each different role is going to take different classes. Makes perfect sense as that goes, but you'll start to see this as we go through this. So a doctor will be taking different classes than a nurse, and that makes sense. Somebody that's a part of registration is going to be taking different classes than somebody that might be in billing. And so those are some ways these things are broken down. You do not have to be now an expert, nor will you be an expert at the end of this. It's just good to know. So again, this is some of the terminology that you'll hear through this project. Not something that you have to be an expert at. The more that you know about these things, the easier it's going to be day to day. So I would absolutely review these. It'll help your life day to day. These are some things that I think are very good to know because, again, they're specific to training. So you'll hear the word UPA, End User Proficiency Assessment. So all of the folks that are taking these classes, at the end of them, they're going to take what is a sense of UPA, and you'll hear that word. Some people get flustered by that. I was not the best test taker. University of Georgia can tell you that I was not very good at that. Some folks are okay with it. Some folks are not. That's sometimes where we need to do the care and feeding. Login labs, not something that you're going to have to really work on here. That's something our team will take care of more at the end as we get closer to the Epic Go Live. ACE, that's actually the environment, or what I would call application, where people are doing some of their training. Hyperspace, that's just an Epic application where students log into. So you logged in Teams to be on this, they log into Hyperspace. Playground, that's a place where they can do just that. They can actually practice the different modules. So it might be orders, or it might be ClinDoc, or it might be Radiant that they're training on. They can do some of those type of things. Prod, we're not going to really worry much about that because, again, we are not going into Epic to do anything. We're not changing anything. That's not what we're there for. We're not certified to do that. So going through those. And with that, that's all fun. And I think I'm under time. So I'll stop sharing as best I can. Susan, Mike, what are we thinking? How'd I do?
Great job.
Very good.
You covered all the points I was going to touch on. I think the cell phone thing's the most important. The hospital knows that everyone needs one, and
Sure.
and for emergency purposes and whatnot, but they are not very tolerant about like people watching videos on them or being on their phone when, say, a customer or a client is near. So just use your best common sense there.
Yeah, and there will be things, and again, I think questions and let's see who has a question. Jax, I'll get right to you just for a second. There are questions like, hey, we're there for 12 hours. If I'm you, when do I eat? When do I do these type of things, right? There's some of those nuanced things that we'll get to. Some of it is going to be, hey, what's the lull? So sometime lunchtime, right, is a busy time. People are on lunch, they're going to come get this done. So it might not be the best time for us, right, to be out. But if there's a downtime, hey, take that time, some of those things. But I'll take a few questions and then we'll try to get you guys out early. Jackson, go ahead, buddy. I think
Jackson's probably had his hand up since we started. I don't know if that was
cool. He's waving, saying hi.
Yeah. There we go.
Correct. All right. Good deal.
Glenn, I also wanted to say it may be possible for you guys to be able to bring in your own snacks and food into this kind of environment too, if you're on kind of your own diet. We've done that before, so that's another thing we should probably verify for you.
Yeah, you definitely will. I think that's good. I'm always sensitive because I was the guy back in the day would bring boiled eggs and everybody hated me for it. So I've learned that, hey, sometimes, I need to be sensitive on what I'm bringing, right? And when I open those things, whether to go in the break room or something like that. Y'all are going to know too much about me by the end of this project. Any questions? If not, we can adjourn early.
I'll say this, Glenn, I'll try and I will definitely get an updated schedule out. I just, so everyone, you should know this by now from your recruiter or whatever, but I think also we should probably send out kind of a phone tree so people know each other's numbers. So it might make it easier for you to call in for somebody to help fill your position if you are out sick for some day, but I'll be there to help with that too. But I don't know what you think about that, Glenn, but we do have a roster we can share.
I love that. And I'll kind of, as we go through the project or get closer to your start date, we'll learn more. The way we have it set up, so everybody knows their schedules. There's kind of the Monday through Wednesday at a location. There's a Thursday through Saturday at a location. Okay. Some facilities, so the forum, there's basically 2 rooms on each floor. So we're going to have kind of 2 people on one floor, 2 people on another floor per shift, right? So that's kind of how it's broken up. Cartersville's smaller. So we have 1 person per shift in Cartersville. Okay. So those are critical things to know. And not that we want to, have to lean on somebody else, or we say, okay, well, there's somebody else I can just put my hands up, because those forum facilities are large. There's a room with 120 computers. There's a room with 80 computers. My experience is not all of those are filled, okay? But we need to understand that, hey, we want to be present, right? When those things start getting busy, we're going to need all hands on deck. And so, yeah, we'll get that out. That'll be good. But I'll just say, as we close, thank y'all so much. We'll get to know each other, really well. I think this will be a great project. Again, it's a great stepping stone to learning about Epic, getting that face time with the physicians, doctors, and nurses. I've got some of the best references or accolades, from these type of projects, because you're literally right there with the physicians and nurses doing something they don't like to do. So that actually is the time where you can shine the most. So with that, hope you guys have a great day, and then we'll send out the invite for Friday. And again, we can talk through some of the details on that. We'll get the notes out from this. We'll get the PowerPoint out from this, and we'll keep on trucking. All right.
All right.
Great.
Thank you, guys. Have a good one.
It's good to see
Thanks,
y'all. Take care.
everybody.
Thank you.
You too.
Thank you, guys.
Thank you.
Thank you.